So good day. Now I am going to perform on how to do the nursing assessment of the cranial nerves 1 to 12. So the first thing to do is to gather the equipment needed for the examination, and then provide privacy to the patient, perform hand hygiene, and explain what you will be doing to the patient. So let's get started. So now we're going to test the cranial nerve number 1, olfactory, the sense of smell. So sir, can you close your eyes? Thank you. I'm gonna put something in your nose and then have you breathe in and smell. So can you please tell me what you smell?
Vanilla.
Okay. The next is we're going to test the cranial nerve number 2. So now we're gonna be doing two tests. One is we're going to look at the confrontation visual field, and we're going to be looking at their peripheral vision. So next we'll be using a Snellen chart to assess. First, we're going to assess the peripheral vision by doing the confrontation visual field test. And to do that, we're going to let the patient stand in front of me. So, sir, can you please stand up? In front of me, about arm's length away. So, sir, I'm gonna have you cover up your right eye. Okay, then I'm gonna cover up my left eye. That's right, on the same side. So, sir, I want you to look at my eye and don't look at my finger. And please tell me how many fingers you see. I'm gonna do this in the upper and lower visual field and about the middle of the visual field. So here we go.
2, 3, 2, 2.
Okay. Okay, so the next is that we will be using a Snellen chart. So for this test, I'm gonna hold this Snellen chart for about 14 inches from the patient's eyes. And then the patient's vision should be recorded for each eye separately with and without glasses. So sir, do you wear any eyeglasses?
No.
Okay, so the patient wearing bifocal should read chart through lower segment of glasses, or nearsighted patients should read chart wearing glasses. So the patient do not wear eyeglasses. So sir, can you tell me which line will you be reading?
4.
4. Okay, can you please read it for me with your eyes covered on the left? Okay.
May be considered a parallel to what are called comforts or convenience in arrangement of a personal nature and fatigue. Though nature provides both means of rest and animal hit without them, the true gentleman and
Okay, very good. Can you please do it in the other side? The other side. Okay, which line will you be reading? Number
5.
number 5. Okay.
In merely removing the obstacle which unbarrers action of those about him, and he concurs with their movements rather than take the initiative himself, his benefits.
Okay, sir, can you read it again with both eyes? Which can you tell me which number will you be which line will you be reading?
Number 4
Okay.
may be considered as parallel to what are called comforts or convenience in arrangement of a personal nature and fatigue. Though nature provides both means or rest, an animal hit without death, the true gentleman Inc.
Okay, sir, thank you very much. So next is we're going to assess the cranial nerve number 3, which is the oculomotor, the cranial nerve number 4, the trochlear, and the number 6 is abducens. And we're gonna do several tests to check their function. So the first one we're gonna do is we're gonna be looking for any involuntary shaking of the eye called nystagmus. How we're gonna do that is we're gonna take our pen light and hold it about 12 to 14 inches away from the patient's nose. So, sir, can you please steady your head and Please don't move your head and just use your eyes to watch where I move the pen light. Okay. So next is we're gonna check for accommodation. So sir, can you stare on that object, distant object? Okay, thank you. So it can help to dilate your pupils, and I'm going to use a pen light finger and slowly move inward to the nose, and I will check if those pupil constrict, they accommodate, and eyes cross while looking at the pen light. So here we go. Can you please stare on the pen light? Thank you. Okay, so now we can document because we just checked all the things with the eyes, and we can document that the pupils are equal, round, reactive to light, and accommodate. So that's where the acronym PER comes into play. So next is we're going to test cranial nerve number 5. So which is the trigeminal nerve, and this nerve is responsible for many things like mastication. So sir, can you clench your teeth like bite down for me? Okay. And I'm going to feel the masseter muscle, and it should have a nice firm ball, and then feel the temporal muscle. Okay, thank you. So sir, can you open your mouth against resistance? Okay, thank you. Okay, so while we're here, we're gonna go ahead and look at the facial expression and test cranial nerve number 7, which is the facial nerve. Okay, sir, can you close your eyes tightly and open them up? Thank you. So now smile for me. Frown. And pop up your cheeks. Thank you, sir. So you did that with ease, so your cranial nerve is intact. So next we're gonna test cranial nerve number 8, which is the vestibulocochlear nerve. And what I'm gonna do is I'm gonna include one of his ears and then whisper word on the other side. And he needs to tell me what I said. So are you ready, sir?
Yes.
Okay.
Popcorn.
Okay, so your cranial nerve number 8 is intact. The next one we're going to assess is the cranial nerve number 9, which is the glossopharyngeal. So, sir, can you please say ah? I'm going to test your gag reflex, and I'm gonna poke a little bit back there and elicit the gag. Okay. Um, Okay, and the cranial nerve number 10, the vagus, is intact because he is able to talk to me without hoarseness, and he's able to swallow. So now let's proceed to cranial nerve number 11, which is the accessory nerve. So, sir, can you move your head side to side? Up and down. Okay, and then shrug. Try to shrug against my resistance. Very good. So you does that with ease. So your cranial nerve number 11 is intact. So the last cranial nerve assessment, number 12, is the hypoglossal nerve. So sir, can you stick out your tongue? Okay, can you move it side to side? Okay, very good. So you does that with ease. So your cranial nerve number 12 is intact. Sir, can you please walk naturally across the room? Sir, can you please walk heel to toe? Sir, can you please stand erect with your arms in the side and close your eyes for about 20 seconds? Can you please stand on one foot, bend the knee, and hop on? On the other side. Thank you. Can you please touch the tip of your nose with your right index finger. And then with your left. And then with your right. Close your eyes and do it again. Sir, can you touch each finger to the thumb and to increase the speed of it? So, sa gamay. Please lie down in a supine position. Then, slide your onto the left shin. Okay? And then do it in the other side. Thank you. Sir, can you please close your eyes? And then tell me where it is and what it is and the texture of.
Soft pulp.
How about this?
The back of the hand.
Sir, can you Sir, can you please determine if it is hot or cold?
Hat.
Okay. Sir, can you please close your eyes and tell me where is the direction of your pointer finger? It's
Right. Left. Up. Down.
okay. Can you please close your eyes and identify what object I am putting in your thumb?
Cut.
Sir, can you please identify if where I am going to touch you?
Shoulder. Nose.
Sir, can you please identify what I am writing on your thumb?
Heart. Circle.
Yes. I don't think. Laki mo vibration. Na. Dapat na kayo ma-feel.